Melchert, and I'm from the Department of Molecular Pharmacology of the University of Groningen. Today's date is March 27th, and this is a recorded class for the course Pathology and Immunology for the first year pharmacy students. So in this particular class I'll be talking about Th2 and Th17 immune responses. In other videos I've talked about the cellular response, so the response of lymphocytes with B lymphocytes, CD4 positive and CD8 positive T lymphocytes. And I've explained that these CD4 positive T helper cells can help other cells with effective immune responses, and we've talked about Th1 responses that can help with intracellular bacteria. But of course we are exposed to many other threats like viruses, fungi and parasites. So in this class I'll talk about Th2 and Th17 responses that can help out with parasites and extracellular pathogens like fungi. So if a tissue is exposed to a parasite or to a fungus, then the dendritic cells that take up part of these organisms will tell the naive CD4 positive T cell in the lymph nodes that it needs to develop into a Th2 cell or a Th17 cell. That will then start to proliferate, divide, go into the blood and move to the tissue to help out with elimination of microbes. So what are effective functions of Th2 cells? Th2 cells are needed to help out with parasite infections. Parasite infections need a different approach than bacteria that have been phagocytosed with by macrophages, because parasites are usually way too big to eat. So how do you kill something that you cannot eat? That is shown in this picture. So here is the antigen presenting cell, the dendritic cell, that has eaten part of the helminth or parasite and is presenting part of that to the naive CD4 positive T cell that also gets signals from the dendritic cells that it needs to change into a Th2 cell. So it will proliferate and differentiate. And these cells make IL-4, IL-5 and IL-13. Why these specific cytokines? Well, IL-4 and IL-13 help with mucus secretion. They stimulate the production of mucus by mucus producing cells in the gut and in the lungs, and they help with peristalsis. So if there is a parasite in your gut, the mucus and the increased peristalsis will help to clear the worm from your gut. IL-5 will call in help from eosinophils, and eosinophils have receptors on their cell membrane that can bind IgE antibodies. And these IgE antibodies are specific for the parasite. So when these IgE antibodies bind to the parasite, the eosinophil will become activated and will start to exocytose all sorts of molecules that are toxic to the helminth. So it's not trying to eat the helminth, it is just showering it with toxic molecules to kill it, basically, and to make it fall apart. And a similar thing happens with the mast cells that are already present in tissues. They also bind IgE antibodies that recognize the helminth, and they do the same thing. They also degranulate, exocytose toxic molecules to kill and dissolve the helminth. So how do you get these IgE antibodies? Well, these IgE antibodies you get because these Th2 cells tell the B cell that it needs to make IgE. So it really stimulates the production of IgE antibodies. All this throwing about toxic molecules that should kill a parasite, of course, will also give tissue damage, because these toxic molecules do not know the difference between self and non-self. So IL-4 and IL-13 stimulate macrophages to become M2 macrophages, or alternatively activated macrophages. And these are the ones that help out with tissue repair and fibrosis, to make sure that the repair that is being caused by all these toxic molecules, the damage that is being caused by all these toxic molecules can be repaired. Of course, we used to be exposed to lots of helminth in the past, but with our cleaner way of life in most of the Western countries, we don't see a lot of parasites anymore. And we actually know this Th2 responds best from a disease which is caused by these Th2 cells, and that is asthma. And asthma is an immediate hypersensitive reaction, amongst others caused by IgE. So what is asthma? Asthma is a Th2 response to allergens that you normally would not respond to, but somehow the immune system of certain individuals with a certain genetic predisposition or early life exposures decides that the antigen inhaled from house dust mite or from pollen or from cat dander are toxic to your lungs in this case. So these allergens normally would be inhaled, and your epithelial cells would be exposed to these allergens. Now, underneath the epithelial cells you have dendritic cells that will eat the allergens, but they won't get signals from the epithelial cells that it is dangerous. So these dendritic cells will tell T cells that this is not dangerous and that they should tolerize these, that they should be tolerant for these allergens, and that it should develop into regulatory T cells that can downregulate immune responses against these allergens. So that's what happens in a healthy individual that is not at risk for the development of asthma, but in people that have the capability to develop asthma, so because of genetics or early life exposures, the epithelial cells are not completely normal. They will see these allergens as dangerous, and they start producing cytokines that will tell the dendritic cell that it needs to get Th2 help. So these cytokines are TSLP and IL-33, for instance. This dendritic cell will go to the lymph nodes and tell the T cells there, if you recognize this is dangerous, I need a Th2 cell. So then the Th2 cells will develop and will move back to the lungs. So they will produce IL-13, which will increase mucus production because the immune system thinks it's sort of a parasite. The B cells will start producing IgE because it thinks there's a parasite. And IL-5 will lead to the recruitment of eosinophils in the lungs. Both eosinophils and mast cells will be coated with IgE against the allergen. So the first time this happens in an potentially asthmatic person, we call that the sensibilization. Nothing much is happening yet, but the immune system is primed. It's getting ready for a real response. So the mast cells are now coated with antibodies, the eosinophils are coated with antibodies, and then when you subsequently inhale this allergen again, then your mast cells will respond because they will immediately recognize the allergen through the IgE that is bound to them, and they start to degranulate. The eosinophils will do the same, and more eosinophils will be recruited as well. And of course there'll be lots of mucus production. Also, you get proliferation of airway smooth muscle cells that will contract and make you feel short of breath. And this basically leads to the symptoms of asthma that we know. If somebody who's asthmatic inhales an allergen, what you usually see is a early response and a late response. And this early acute response is being caused by the mast cells and the eosinophils that are present in the lung that start degranulating and releasing toxic molecules that will lead to the contraction of airway smooth muscle cells and subsequently make you lose lung function, because the y-axis here is lung function, so you feel short of breath. But that when these toxic molecules, they're short-lived, so when they're done, then the smooth muscle will relax again and you can breathe again. But then after around 6 hours, a new wave of eosinophils will come into the lungs and start getting activated. And since then that is lots of cells coming in, you'll get a really dramatic response to the allergen, and we call that the late phase response. And you have a very low lung function because of these eosinophils responding to the allergen. We also have Th17 cells that are meant to respond to extracellular threats like fungi. Its most important cytokine is IL-17. So if a dendritic cell eats up an extracellular bacterium or fungi, then it will present parts to the naive CD4 positive T cell. It will give it signals saying we need Th17 cells. So these cells will develop, and these cells make IL-17 and IL-22. Why these cytokines? Because IL-17 and IL-22 both will tell epithelial cells to start producing antimicrobial peptides to help out with the immune response at the local site of infection. IL-17 will make sure that neutrophils will come in. And neutrophils can eat lots of bacteria and fungi and are very metabolically active and can kill these phagocytosed bacteria. They can also set these traps, these neutrophil extracellular traps that can catch bacteria that are moving around. And IL-22 actually can increase the barrier integrity of the epithelial cells, so it will be more difficult for new bacteria or fungi to come into the tissue. So this inflammation is characterized by neutrophils, and with neutrophils producing lots of oxygen radicals and making these extracellular traps. So this also leads to inflammation and tissue damage that you will see when you're infected with bacterium or fungi. So as an example, for instance, Aspergillus, that's a fungus that grows in damp conditions. So I think a lot of students know this fungus from their bathrooms that are, and it's coating the ceiling because the bathrooms are not ventilated well enough and used a lot. So it's very humid and a little bit warm, so it's a good condition for this fungus to grow. So this fungus produces spores that you can breathe in, and your immune system will respond to these spores by calling in neutrophils to help out with catching these spores and destructing them. And also with calling in your adaptive immune system and telling that you need Th17 cells. So in healthy conditions, you'll get Th17 cells that will help you out and remove all the spores. But in people with airway diseases, they might actually get extra pathology because they already have an inflamed lung, and then the increase of Th17 lungs will make the disease, Th17 cells will make the disease worse. So this form of Th17 mediated airway disease is characteristic of, for instance, non-allergic asthma. So asthma that is not caused by an allergen, so there's no Th2 cells in the lungs, but for instance, because you're breathing in these spores from Aspergillus, or you're being exposed to cigarette smoke or other bacteria, your immune system responds to it and asks for the influx of Th17 cells or Th1 cells that cause an airway inflammation that is characterized by neutrophils, and can also lead to the contraction of smooth muscle that will make you short of breath. And more about allergic and non-allergic asthma will be discussed in the video about lung pathologies about asthma.